Hi friends, I am Dr. Dattaram. I am a consultant surgical gastroenterologist and laparoscopic surgeon practicing in KIMS Hospital, Gachibowli, Hyderabad. Today let us talk about bariatric surgery. This is one of the common surgeries, bariatric surgery. Bariatric surgery is also called as metabolic surgery. This is nothing but weight loss surgery. So weight loss surgery is like a boon to the people who are having obesity and associated health issues due to overweight and obesity. So morbid obesity means obesity or overweight which is going to be a threat to your life. Obesity causes a lot of health related issues. So it can increase the risk of developing diabetes, hypertension, dyslipidemia, that is high blood cholesterol levels, fatty liver and steatohepatitis, damage to the liver due to excessive fat in the liver, and obstructive sleep apnea. So patient obstructive sleep apnea is one of the common problems what we see in obese patients, and due to that a lot of people with obstructive sleep apnea, they are not able to sleep. They sleep more during the daytime, and they also develop right heart failure. And osteoarthritis is damage to the knees due to obesity and overweight. So people with obesity have a high chance of developing osteoarthritis, polycystic ovarian disease, annual cycles, infertility, low self-esteem. People with obesity also have higher incidence of mortality. So risk of dying due to in patients in sudden death during sleep also is very high in patients with obesity. Risk of cardiovascular mortality, death due to cardiovascular problems also is very high. Risk of developing cancers, especially the large intestinal cancers, also is very high in patients who are having obesity. So BMI, we use something called as body mass index. Body mass index is nothing but body weight in kgs divided by the height in meters square. So anyone who is having more than 30 BMI, that is BMI more than 30, and these are called as obese people. So this is called as morbid obesity. So patients who are having body mass index more than 30 along with comorbidities, that is like diabetes, hypertension, dyslipidemia, obstructive sleep apnea, etc. These are the candidates who should consider bariatric surgery. And people without even without comorbidities, if your BMI is more than 35, then you are a candidate. You should seriously consider the option of bariatric surgery. This is the Western data. Coming to the Indians, the risk of having problems is much higher at a lower BMI. That is, as even if BMI of 27, and if you have comorbidities, then in Indians do qualify for a bariatric surgery. So what is the first treatment or approach to a patient who is obese? Before bariatric surgery, it is very important to change your lifestyle. So lifestyle modification is very important. Adapting a healthy lifestyle is very important for weight loss. Diet, especially calorie deficit diet. So diet low in carbohydrates, high in protein, and low in fat is very important. Should have a calorie deficit diet consistently. If you are taking a calorie deficit diet, that is very important part of your weight loss program. So again, daily exercise in the exercise to burn fat, daily exercise in the form of aerobics or weight training or swimming, etc., or any sport which helps to reduce weight has to be adopted as a lifestyle measure for weight loss. Two main mantras for weight loss are diet and exercise. So many patients with very high BMI are not able to do these exercises, and they already have comorbidities. So these are the patients who should consider bariatric surgery. Also without comorbidities, and if your BMI is more than 35, then that weight can cause serious health concerns. Serious health concerns can risk your life, and these are the candidates who should definitely consider the option of bariatric surgery to lose weight. Many patients they cannot follow these lifestyle measures. They find it very difficult to walk because of the weight, and they cannot do these lifestyle measures. They cannot go for regular exercise. And these are also the patients who can consider bariatric surgery as a best option. So what is bariatric surgery? So bariatric surgery is nothing but it's a laparoscopically performed surgery. Two types of bariatric surgery. One is restrictive surgery. The other thing is malabsorption surgery, or restriction plus malabsorption. So restriction is the stomach capacity is reduced. Generally, we have something called sleeve gastrectomy, wherein major part of the stomach is removed and the stomach is converted to a small tube. Normally, the stomach can accommodate food up to 2.5 to 3 liters of food, and this can be reduced to less than 200 or 150 ml. So this is called as sleeve gastrectomy. The major part of the stomach is removed and the stomach is formed, it's made into a small tube. This is called as sleeve gastrectomy. This restricts your food intake. There are malabsorption procedures like Roux-en-Y gastric bypass and mini gastric bypass, wherein along with the restriction, the intestine also is bypassed. So when the intestine is bypassed, the food goes into the distal intestine, the lower intestine, and the absorption of food comes down drastically. So these two things help to achieve weight loss, and majority of these patients either go for malabsorption procedure or combined malabsorption and restriction procedure or restriction procedures alone. These malabsorption procedures are done for patients who are having diabetes and other metabolic problems. These patients who are having metabolic issues, they are more benefited by doing a malabsorption procedure because the weight loss is more consistent. So patients who are having metabolic issues, they especially long-standing diabetes, these are the patients who do well with bypass procedures. So what is the mechanism by which bariatric surgery helps in inducing weight loss? So if you see, once we do bariatric surgery, the food intake comes down drastically. The stomach restricts food intake because the stomach is converted into a small pouch. So this restricts food intake, and over a period of time the patient loses weight. So how does bariatric surgery help in remission of diabetes? So when there is weight loss, the fat is gone and the insulin resistance drastically falls. So when the insulin resistance drastically falls, the available insulin in the body works more efficiently. The body tissues are sensitized and insulin sensitivity improves and diabetes resolves. Not only that, there are a lot of other hormonal changes which happen after bariatric surgery, especially after bypass procedures. The anti-incretins decrease and the incretins increase. Incretins are small hormones which work like insulin, but anti-incretins are hormones which have a function opposite to that of insulin. So there is a change in the balance of these hormones and the blood sugars get controlled. These are the mechanisms by which bariatric surgery induces remission of diabetes. This is shown both in animal trials as well as humans who undergo bariatric surgery. What are the benefits of bariatric surgery? So with bariatric surgery, there is consistent and definite weight loss. More than 50% of excess body weight loss is gone, and there is a resolution of comorbidities. So diabetes gets resolved, hypertension gets resolved, your sleep apnea gets resolved, etc. Most of the patients who undergo bariatric surgery, the diabetes gets resolved. Many of them will be able to stop the medications or decrease the dose of insulin, or stop the insulin, or decrease the dose of oral hypoglycemic agents. The sugars get controlled very well, the HbA1c improves, and many of them, once their sugars are normal, they can actually skip the medications and live a normal life. Hypertension, even hypertension, once the body fat comes down, once the body weight decreases, many of these patients can reduce the dosage of antihypertensive medications or stop them. Even patients with obstructive sleep apnea, majority of them will be able to stop the CPAP, and snoring comes down, they sleep better, and the effects on the heart can be reversed or stopped from further worsening. So after bariatric surgery, many of the patients who are having knee problem, osteoarthritis and knee pain, the pain decreases significantly, and many of them may avoid a knee replacement. Coming to NASH or non-alcoholic steatohepatitis, patients with liver fibrosis, the further fibrosis can be stopped and the fatty liver can be significantly reversed. The fatty liver may literally disappear after bariatric surgery. Patients with polycystic ovarian disease, PCOD, they also improve significantly. Many of them will be able to conceive after bariatric surgery. Many patients who are having depression and low self-esteem have shown significant improvement in mental health after the operation. These are few definite benefits of bariatric surgery. Most of the patients look at bariatric surgery as a risky operation, very major surgery. So patients also see and ask me the procedure may fail after the surgery. So coming to it is like bariatric surgery, I would say that it is adding life to your ears. So it is a boon and it is definitely beneficial. Living with comorbidities is a pain, and the comorbidities cannot be resolved, that is going to cause end stage damage to organs and can cause and can decrease the lifespan. So it has been shown that people who are obese, the risk of the lifespan is lesser compared to normal individuals. So patients who are having obesity have a shorter lifespan than normal individuals, and also risk of sudden death is also higher in patients who are obese. So bariatric surgery is definitely a boon to patients who are having morbid obesity and who are not able to control the weight and reduce the weight by themselves. Bariatric surgery is definitely a boon. Coming to the regain of weight after bariatric surgery, it is multifactorial. At least 10 to 15% of patients may see some regain of weight after bariatric surgery. So what is the chance of regaining weight after a bariatric surgery? Most of the patients who undergo bariatric surgery have an excellent result. They lose weight significantly in the first 2 to 3 years, and after 3 years many of them plateau. The weight loss is plateaued. Some patients see regaining weight after the surgery. So it is multifactorial, not a single factor, which is very important, because the body tries to get back to its original point. There is a set point of the body. Everyone has a set point, and they try to regain weight to that set point. Second thing is a lot of adaptation which happen within the body. The stomach pouch may dilate with time, and the intestines may start absorbing more. They also adapt, and they also develop more villi. The mucosal absorption is increasing after bariatric surgery. The most important thing is compliance. Many patients are not compliant with the post-operative dietary changes. So bariatric surgery is nothing but a new lifestyle. You're adopting a new life. So diet protocols, following strict diet protocols, the calories which you consume, the kind of food you consume after bariatric surgery is very, very important. So if you take excessive fats and if you take a lot of calories, so if you're taking calorie dense foods after the surgery, you're taking a lot of sweets, and if you take ice creams or milkshakes, etc., if you take these things in plenty, high calorie foods in plenty, then the chance of having weight regain is high. Not only that, lack of exercise. It's very important to be physically active after bariatric surgery. It's very important to have a regular exercise in the form of brisk walking or swimming or cycling, jogging, etc., or weight training to maintain the weight loss after the bariatric surgery. If you don't do these two things, then the chance of developing or regaining weight after the surgery is going to increase. So generally up to 10 to 15% of patients after the bariatric surgery we see some weight regain, and this can be prevented by a regular post-operative visits. So after the surgery, it's very important to consult the surgeon, consult your dietitian, revise your diet charts according to your weight, and it's very important to maintain the weight by a strict diet plan and also a regular exercise after bariatric surgery. Some patients we have seen they take a lot of carbonated drinks like Coca-Cola, soda, etc. When this gas is released in the stomach, it tends to distend the stomach. It increases the size of the stomach. So it is very important not to take these things, not to take these carbonated drinks, and also avoid taking food and in large volumes, and also taking liquids as gulps. So if you do these things, the pouch tends to dilate, and the food capacity, the restriction comes down, and you tend to eat more. So if you take these precautions, that is the diet protocol, the kind of diet you're taking, avoiding these carbonated drinks, avoiding gulping, taking too much of food at a time, if you do, and having a regular exercise, then the chance of weight regain after bariatric surgery is very, very less. Thank you so much.